Well, the county coroner has confirmed that a baby's body was found on the side of I-82 between Richland and Benton City earlier this week. An autopsy has been completed, but so far details in the case are very limited. The Benton County Sheriff's Office says deputies responded to an I-82 on-ramp for a report of a deceased infant. According to the autopsy, the infant was determined to be 30 weeks old, a female and stillborn. They say the death investigation is still ongoing, but anyone with details is asked to contact the Benton County Sheriff's Office. Now, before we knew any details about this case, it sparked a conversation about what someone should do if they feel like they have nowhere to turn to, if a person is unable to care for a baby, whatever reason it may be. Cap KVU's Rylee Fitzgerald says there are places in the state that can be that safe haven.
In Washington state, there are 72 hours after the birth of a baby that they can be dropped off at safe haven locations.
Newborn infants are most vulnerable in those first 72 hours.
These locations include the emergency department of a hospital, a federally designed rural health clinic during operating hours, and fire stations while they're open or staffed. Richland firefighters say a key portion to make sure this is a lawful and safe practice is to hand deliver the child to a professional, whether that be at a hospital or fire department.
We can't have people just drop an infant at the back door. The transfer has to happen person to person.
We are going to try to acquire some medical history, maybe a little bit of background information, but that person can also remain anonymous if they want as well.
As long as it's at one of those locations, unharmed and hand-delivered, this is legal. It's a way to lawfully and safely surrender a newborn for any reason someone may have.
We do have trained personnel on site, so trained from labor and delivery all the way to taking care of a child that could be a few days old.
Crews say it's not just for the health of the baby, but also for the parent.
We also want to make sure that we're taking into account both medical, physical, and mental aspects of care for the parent. So the parent may not be ready to engage in that conversation yet, and we'll certainly respect their anonymity if they want that.
In Richland, Rylee Fitzgerald, Cap KVU Local News.
Richland Fire and Emergency Services says this program has been active for a decade and they haven't yet had to put it into action.